navigating sinus congestion safely with hypertension when allergy season arrives or a cold sets in. The urge to clear a stuffy nose is powerful. However, for the millions of people living with hypertension, high blood pressure, a trip to the pharmacy can be a minefield. Many common, over-the-counter, OTC, decongestants contain ingredients that can inadvertently spike blood pressure, potentially leading to serious cardiovascular complications. Understanding which medications to avoid and which alternatives to embrace is essential for managing congestion without compromising heart health. The science: why decongestants affect blood pressure. To understand the risk, one must understand how decongestants work. They are designed to cause vasoconstriction, the narrowing of blood vessels. In your nasal passages, this constriction reduces swelling and inflammation, allowing you to breathe more easily. However, this process is not localized to your nose. According to Dr. Nia Jones, a cardiologist at University of Maryland Medical Center, the body uses alpha-adrenergic receptors to signal blood vessels to tighten. With high blood pressure, the system is out of balance, says Dr. Jones. The heart is being forced to pump against stiff pipes. When blood vessels continue to clamp down, long-term damage to the heart can occur. For someone with hypertension, this systemic tightening can turn a minor respiratory annoyance into a significant cardiac risk. Oral versus nasal. Understanding the delivery method, the way a medication enters your body significantly changes its impact. Oral medications. Once swallowed, these are absorbed into the bloodstream and act systemically throughout the entire body. This makes them much more likely to raise heart rate and blood pressure. Nasal sprays. These provide more localized relief. While they are not entirely without risk, experts suggest they are generally a safer route for those with difficult-to-control blood pressure, as the medication stays concentrated in the nasal tissue. Medications to avoid: if you have hypertension, you should exercise extreme caution with or avoid entirely the following. Pseudoephedrine, found in products like Sudafed Congestion or Afrinol. This is a potent stimulant. Phenylephrine, found in Sudafed PE, Sufedrine, or Actifed. Combination products. Many all-in-one cold and flu medicines, such as Tylenol Sinus Severe or Advil Allergy Sinus. Mix decongestants with antihistamines or pain relievers, making them high risk for hypertensive patients. NSAIDs, medications like ibuprofen, Advil, Motrin, can also affect blood pressure. While useful for inflammation, they should be used cautiously and ideally under medical guidance. Safer alternatives for relief. You do not have to suffer through congestion. There are several ways to manage symptoms more safely. Targeted medications: antihistamines. If your congestion is caused by allergies, medications like loratadine, Claritin, or fexofenadine, Allegra, can prevent mucus buildup without affecting blood pressure. Inhaled corticosteroids. Sprays like fluticasone, Flonase, are effective for allergy-related swelling. Specialty lines. Brands like Coricidin HBP are specifically formulated to treat cold symptoms without using decongestants that raise blood pressure. Oxymetazoline, Afrin, an effective nasal spray for quick relief, but use it for no more than 3 days to avoid rebound congestion, where your nose becomes even more stuffed once the medicine wears off. Natural and mechanical methods: saline rinses. Using a neti pot or saline spray can thin mucus and reduce swelling naturally. Steam inhalation. Hot showers or vaporizers help moisten nasal linings. Nasal strips. Mechanical aids like Breathe Right strips physically lift the nostrils to improve airflow without any chemical intervention. Hydration. Drinking plenty of fluids helps keep mucus thin and easier to clear. Expert advice. Consult the professionals. The most important rule of thumb is that over-the-counter does not mean risk-free. Medical experts recommend 2 key steps before starting any new regimen. Talk to your pharmacist. They are an underutilized resource capable of checking for interactions between your new cold medicine and your existing blood pressure prescriptions. Consult your physician. Always inform your primary doctor about any supplements, vitamins, or OTC drugs you are taking, as even minor ingredients can impact chronic conditions. Summary: for those with high blood pressure, systemic oral decongestants pose a risk of increasing vascular resistance and heart strain. Prioritize localized nasal sprays, antihistamines, or natural remedies, and always consult a healthcare professional before mixing new medications with existing treatments.